Everybody, this is June 8th. I'm just a few days shy of being 6 weeks since my left arm surgery. It's kind of the last surgery of my upper extremity group of surgeries, minus any future things I might need for my wrist. But I just got done again 6 weeks ago with my direct ligament repair of a certain bundle of the medial collateral ligament that was causing a little gapping on the joint with some valgus stress on it. And while he was fixing that, it was a direct ligament repair with like Arthrex push lock anchors, fiber tape. It wasn't a full Tommy John reconstruction type surgery because not all the ligaments of the elbow were bad, just one little section. And then while he was in there, he went under here, similar to what he'd already done on my right arm a year ago. The medial nerve was decompressed under the level of the pronator teres. It was like a step cut lengthening of the pronator teres, which decompressed the median nerve. Because sometimes people can have medial nerve compression at the carpal tunnel, but sometimes it can be coming from a more proximal. Mine's up at this area. I've never really had any carpal tunnel syndromes. I had pressure here, and I just had atrophy and these muscle bellies and weak, just general, very much hand weakness. Then he also decompressed out here. Here's the elbow. Here's the lateral epicondyle. I already had a scission there from 2016. He had fixed that ligament back then on that side of the elbow in 2016. But I did have radial nerve problems after that, or I had some radial nerve problems before that surgery. But it got a little bit better over the time of using my shoulder or my neck and better biomechanics, but I still had a level of radial nerve compression, which was creating a lot of weakness down into my thumb, the thumb side of my hand. Plus, it gave way to some of the sensory nerves in here that feed the thumb. Anyhow, so I finally had that surgery done because my right arm was finished as of last November, and it's doing good. You know, the outside, the inside, plus in here, that's all done. My right arm's doing really, it's been doing really good. I can hold 5-pound kettlebell weights in my arm, keep everything lined up and centered, and it's doing really good. I am still deficient in the scaphoid, the dorsal part of the scaphoid lunate ligament in this hand. Still, it does have like a tear in it. I have to kind of manually take my lunate and adjust it, adjust it, and then I can get full bend on my right wrist. Otherwise, the lunate will kind of shift more dorsally this direction. And when we get stuck that way, I can feel the tension build up, and I know immediately to kind of do that maneuver to my wrist, and my right hand is doing pretty good. I'm not sure if I'm doing anything for that in the future or not, because it is my dominant hand. I want to finish my left hand because it really has been twice the problem child as my right. And so, like again, I'm just starting to lift 2 pounds in my hand, and I'll see the surgeon in a couple more weeks, so it should be at 8 weeks, and see how much I'm allowed to progress. But I still have some tension in some of these muscle bellies. Well, actually, these muscle bellies were very atrophied. I describe them as they're filling up, like they're expanding now. That's what I feel with my other side. They're expanding. They're doing better. I still, in certain positions, again, I have a similar issue with my lunate on this side. I have to physically kind of just, adjust it a little bit, kind of distract it. Then I can bend my wrist. And if I use my wrist, keep my wrist really neutral and use my arm in a real neutral position and watch how I use it, I can do pretty good. But if it shifts its position a little bit here, I can feel tension coming up my elbow. So I have a lot more physical therapy to do on it. For whatever reason, these particular scars, even though they don't look too bad, they were just a little extra tight and puckered, and I've been putting some full spectrum vitamin E on them and doing a lot of massage to them. They're not responding as well as all my previous scars. So got a lot to work on. I feel more strength in my hand from the better nerve flow and the better biomechanics here, but I still have some sensory stuff that goes through here, because there's a radial sensory nerve that goes through here, so I still get some sensory stuff here a little bit, but there is a little more strength now into the arm because of the main branch of the radial nerve being decompressed. So anyhow, I don't, for other fellow patients, I've never been able to get my hands to do this, to be able to do what you call extension. I mean, I lived for years with my arms a lot of internal rotation and a lot of pronated type of position with my arms. And I've had to learn to open up my shoulders, open up into more anatomical neutral, and be able to balance the arms, with supination. But that takes good shoulder retraction, scapular stabilization, a lot of things that most of my life I could never do, or never knew to do, or didn't know how to do, or couldn't physically do. I always lived with such chronic, horrible tightnesses and pains out my arm. Again, some of that in my case was directed to the years of the scalene impinging upon my brachial plexus from years of prior whiplashes. But my neck is doing better than ever. It's like I have a new neck. I lived decades, almost 30 years of my life, with just horrible, tight neck, and just tightness. Now it's not. I can have full range of motion. Move my head, both directions, full range of motion. Again, I'm just a little bit limited by this fascial pulling and straining right here a little bit, but again, I'm only 6 weeks from surgery. I know I will greatly improve. Based on my past experiences with my other arm, there's going to be a lot more improvement coming over the next couple months. And then after that sorts itself out, then we'll revisit what's left with the wrists. If there's anything further that needs to be done with the wrists or not, maybe re-image them, do more diagnostics, see what's happening. I want to preserve what I have. I don't want them to get worse. And so I'll make future consults with my doctor regarding that. Okay, so that's my update. Hope everybody's having a good day. Thanks for watching, and we'll be in touch again soon. Bye-bye.